All right, the next thing we're going to look at is Chapter 8, Cognition and Learning, so you can follow along in your textbook. Cognition is the process of acquiring, storing, sharing, and using information. And there are these different components that all make up cognitive function. So, language, thought, memory, executive function, judgment, attention, and perception. So, all of those things make up cognitive function. So, we're going to talk about what are some brain aging myths. One myth is that people lose brain cells every day and eventually run out. That is not true. Another myth is that you cannot change your brain. Also, not true. You can change your brain even as you age. The brain does not make new brain cells. That is also not true. Memory decline is inevitable with aging. Memory decline may be common in aging, but it is not inevitable. And you can't teach an old dog new tricks. And that is definitely not correct either. Elderly people can learn new things. So these were all brain aging myths. Adult cognitive function is complex. It's age-related changes in both the brain and the nervous system. Other important factors include a person's education, their environment, their nutrition, their life experiences, physical function level, emotions, biomedical and physiological factors, and then, of course, there's genetics. So there are aging changes in the central nervous system as well, and you can take a look at that in your textbook. Neuroplasticity, this is where adults can strengthen and increase neuronal connections. It's called positive neuroplasticity. There is a use it or lose it mentality, which is actually important for cognitive and physical health. If you don't use it, then you'll lose it, and so that does hold true. Stimulating the brain can actually increase cognitive reserve. So this is doing different activities like maybe Sudoku puzzles or like brain teasers, anything, or taking a new class, anything that would stimulate the activity in the brain. And the cognitive reserve capacity does vary among different people. And then we already said that genetics, education, lifestyle, all these things affect cognitive reserve capacity. Older adults are thought to use both hemispheres of their brain more equally than younger adults do. They have more use of their frontal lobe in the brain, which helps with abstract reasoning, problem solving, and concept formation. And there is a renewed interest on development of cognitive capabilities that increase with age. I just want to make sure you know the difference between fluid and crystallized intelligence. They make those two things together are what make up an IQ test. Fluid intelligence, which is what we think of as street smarts, and then crystallized intelligence was what we think of as book smarts. Memory is the ability to store and retain information and then retrieve it when we need it. We've got three components. There's immediate recall, short-term recall, and then remote or long-term recall. The recall of new information tends to go down as we age. So processing, reaction time, perception, and the capacity for attention to tasks usually remains intact and sufficient with aging. Memory changes, you will notice that the memory changes when they tend to be worse when the person is in a stressful or unfamiliar situation. So for a lot of older adults or elderly, that includes hospitalization. So their memory may actually be worse while they're hospitalized just because of the stress of the situation. So this, I just want you to go through and look and see, is this dementia? Would you categorize these things as dementia or normal aging? So missing a payment occasionally would be normal aging. Occasionally losing things, again, I would say that all of us have probably occasionally lost things, so that would be a normal part of aging. Losing track of the month or year, This would be more indicative of dementia. Problems taking care of monthly bills, like every month you're having a problem, that's more dementia related. Losing things often, more dementia related. And then occasionally forgetting what word to use and names that you just learned is associated with normal aging. Memory concerns, if there are memory concerns or a family member talks about memory concerns that they have, one thing that you want to do is just continue to monitor the situation. You want to look at it over time. And then if it continues to happen over time, then you may need to suggest that they get testing or do some kind of intervention. But it's just like high blood pressure. You wouldn't take one reading and tell a patient, oh, yes, you have high blood pressure because it was high this one time I checked it. You would look at a pattern over time, and we do the same thing with memory concerns. Just the definition of cognitive health, I'll read it for you. It's the developmental and preservation of the multidimensional cognitive structure that allows the older adult to maintain social connectedness, an ongoing sense of purpose, and the abilities to function independently, to permit functional recovery from illness or injury, and to cope with residual functional deficits. So, kind of a mouthful, but that's cognitive health. Um, Interventions or ways that we can promote cognitive health. One is managing your blood pressure, keeping blood pressure under control. Another very big factor is maintaining physical activity. We'll talk about that later in the semester, but I would say that in all of the people that I have seen, the ones who are physically active tend to age the best. Diet, certainly, using a Mediterranean or a DASH diet, which is like a heart healthy diet. And then keeping tight control of chronic conditions. Tight control means just really managing and treating those chronic illnesses. So if you're diabetic, keeping the blood sugar in good control, depression in good control, if there's high cholesterol. So just having really good control of those diseases. Positive social interaction is important. And then also supplements. We tend to look for memory and cognitive health. We look at or recommend vitamin B12 and folic acid. You can look on this cognitive stimulation with mild dementia. If you want to take a look at that link, that would be great. So how do we promote healthy aging? This is how do gerontological nurses do that? One, we want to educate them about ways to enhance their cognitive health. And we talked about some of those, like just keeping the mind active, doing puzzles, doing different games, learning something new. That all helps to keep the mind active. Doing health promotion, education activities that are tailored to specific communities or specific groups. Doing research and sharing those findings. And then if you look in your textbook under this chapter, there are some best practice tips for maintaining cognitive health that you can look at. These are all websites that you can use as we go through this semester that are good in dealing with the elderly. So the National Institute of Health, the CDC, of course, National Institute of Aging has several. They have a lot of good resources. And then there's the National Center for Creative Aging. This is a checklist, and I don't know, it's kind of hard to see, but these are things that you can do to promote healthy brain aging. So if you look on the first one, it's like smoking cessation, following guidelines on physical activity, having healthy nutrition, continued regarding the importance of intellectually challenging leisure activities, providing education, maintaining healthy weight, so keeping blood pressure under control. So all of these checklists are things, if someone talks to you and tells you, I'm worried about my cognitive health as I age, or I'm worried about my memory, these are all things that you can do to help support them and offer as interventions to help with that. Learning in later life, it should you definitely want to pay attention to what their literacy level, their health literacy level is, and any cultural variations. You want to take advantage of all learning opportunities, whether they're formal or informal. Information technology, definitely the older population is the fastest growing groups that are using technology like the computer and the internet. And then there is a box you can check out in your textbook called Guiding Older Adult Learners. Health literacy, it's the ability to obtain, process, and understand basic health information. Low health literacy, if someone has low health literacy, then that can cause poor health outcomes. They can have inadequate preventative care, higher health care cost, higher risk of mortality, and bigger risk for safety errors. So one thing that you'll need to do is when you are going with the interviews that you'll do in this course, you will do a little tool that will help the person, help you determine what the person's health literacy level is. So make sure that you are familiar with that tool. It's in the resources when it talks about, gives the guidelines of the interview. There's a link, and it's the short scale or rapid scale for health literacy, and basically you give them a list of words and you tell them to define what they mean, and then you score them off of that. Some other tips for promoting healthy aging when we're talking about health literacy: using plain language, and for like educational purposes we say don't use any language higher than a 6th grade reading level. So like if you're making health like pamphlets or flyers, you want to keep it under a 6th grade level. Use the teach back or show me strategies where you tell them something and then have them teach it back to you. Hopefully have an increased understanding of medications, and then serve as the patient advocate. So question 1, components of cognitive function include all of the following except, and the answer is deception. So hopefully that's what you said. And health literacy is linked to which outcome? And the answer is, low health literacy is linked to which outcome? Inadequate preventative care, medication errors, poor health, or all of the above? And it is all of the above. All right, next we're going to watch another thing that you're going to need to do in your interview paper is do what's called the mini-cog test. And so I'm going to show you a video that shows how to perform a mini-cog test, and also how to score it, because this is something that you'll need to do with the person that you go to interview. It's quick, but if you do have questions about it, let me know.
The mini-cog is a 3-minute screening tool to help increase the detection of cognitive impairment in older adults. With training, lay healthcare workers, including medical assistants, can reliably administer the entire mini-cog and score the 3-item recall. However, the clock portion of the test can only be scored by a physician or registered nurse. The testing results are to be interpreted and recorded in the medical record by a healthcare provider, such as an MD, advanced practice nurse, or physician assistant, who discusses it with a patient and their family. When administering the mini-cog, ensure that the patient is in a quiet area, free of interruptions and distractions. It is best to not have friends or family present during the assessment, if possible. Be sure you use the latest version of the mini-cog and that you stick to the provided script. The following video will show how to correctly administer the mini-cog. We will discuss scoring the mini-cog after the video.
Hi Sam, nice to see you.
Hey, good to see you.
It's been a while. I think your last visit in the clinic was about 6 months ago or so.
You're right.
Yeah.
You're right.
Well, I hear from the nurse that you're here to talk a little bit about some trouble you've been having with your left eye. So I'm glad you came in so we can take a look at that. Before we get started with that, we're doing some new things in the clinic. More and more we're looking to prevention. And so when the nurse was in, she was taking your vital signs, looking at the health of your heart and different things. And today we're also going to look at the health of your brain, okay? We call this our checkup from the neck up, okay? It just takes a couple of minutes but requires a little bit of concentration. Sound okay?
Fine with me.
Okay. The first thing I'm going to do is ask you to listen carefully, because I'm going to give you 3 words that I want you to repeat back to me and try to remember them. Okay? The words are leader, season, and table. Can you say those back to me?
Leader, Caesar, and table.
The second word is season, like the changes of the season.
Season, and table.
Right. You got it.
Leader, season, and table.
You got it. Now, Sam, what I want you to do in this circle is make a clock for me. First, by putting in all the numbers where they go.
All right.
Okay?
Well, the way I would go it, I'd put 12 first, 6, 3, and 9, and then try to figure it out from there. I put the center circle, and I need I need to put 1, 2, 4, 5, 7, 8, 10, and 11.
Okay. Now, Sam.
I'm at your disposal.
Yep. Now I want you to set the time. So it says 10 past 11.
All right, 10 past 11. Well, first of all, I have to go to 10 past 11. So I'll go to 10 with that small arm, and I'll go to 11 with the long arm.
Okay. Okay.
What?
Nope, that's good. You're done with that now.
Okay.
Now, I'm wondering if you can tell me what those 3 words were that I asked you to remember earlier.
Well, that's a good question. You really pulled that one on me. All right. I can't remember all 3 of them.
Okay, can you remember any of them?
No, I can't.
Okay, that's okay. Sam, have you been noticing any changes in your memory recently?
Yes, I have.
Yeah?
Yeah.
Okay. Well, I'm glad that we're talking about it
Well,
then.
one of them was season.
Season.
Yep.
You got it.
Because I mistook it with Caesar.
That's right. Yeah, exactly.
Yeah.
Well, I'm glad that we're having this conversation. Maybe what we can do is we'll take a look at your eye, which is why you came in. But before you leave, I'd like to schedule another appointment for you to come back so we can talk a little bit more about how your memory has been.
Beautiful.
Does that sound okay?
That's fine.
Okay.
Scoring the mini-cog involves 2 separate parts, the 3-item recall and the clock draw. There are 5 total possible points. The patient gets 1 point for each word they can recall correctly for a total of 3 points. A normal clock must include all the numbers 1 through 12, each only once, in their correct order and direction. If the patient writes only the anchor numbers, remind him or her that all the numbers must be written down. The clock must also have 2 hands, one pointing at 11 and one pointing at 2. The length of the hands is not scored. A total score of 3, 4, or 5 indicates lower likelihood of a neurocognitive disorder. However, it does not rule it out. The mini-cog is not a diagnostic tool and therefore should not be used to diagnose Alzheimer's disease or other cognitive impairments. So, to score Sam's mini-cog, he scored 1 point on the word recall, as he was only able to remember 1 word. For the clock draw, Sam placed all numerals correctly, but the hands were misplaced. Because the clock draw is scored full points, which is 2, or 0 points if there are any errors, Sam's clock draw score was 0. Sam's total score was 1 point out of 5 possible points. This score indicates a need for further investigation of cognition. Keep in mind that the mini-cog is not a diagnostic tool and therefore should not be used to diagnose Alzheimer's disease or other cognitive impairments. A total score of 3, 4, or 5 indicates lower likelihood of dementia, but does not rule out some degree of cognitive impairment.
Okay, so let me close this. Going back, so what I'd like you to do is try to practice that on maybe another student at school, or if you can practice that on at home with someone. But so again, you tell them 3 words, and then you tell them you want them to draw a clock, and you have them draw the clock with the numbers. And then he said 10 past 11. You can do 2:10 if you want, or 2:15 or 2 o'clock, and just have them put a time down. And then after you do that, you ask them to repeat those 3 words, and then you score them based off of those 3 words. So just try to get some practice doing that. And that ends our show here. Let me end the video.